Welcome back to Midday. Joining us this afternoon is Dr. Robin Rutherford, and he's here with us to talk about your beautiful smile in your mouth. Good morning. Thank you so much for being with us.
Yeah, that's what I usually talk about.
That's right. Smiles. That's your favorite topic. And
yeah.
We actually first brought up dental implants about a year ago, and they're quite popular. And since then, just this month alone, you've already performed 5. And so let's talk a little bit about what they are and who they would benefit.
Right. What I'm going to talk about is dentures. If you have dentures, you know that the biggest problem with dentures is that they won't be still, especially the lower one.
Right.
Upper ones get kind of a suction, and so they stay still better, but lower ones are generally pretty floppy. And the longer you have your dentures, the more the time goes by, the more the gums and the bone shrinks away. And so there's less and less for a denture to get a grip on. And that's where people use denture adhesive, always trying to glue them in. And people continually tell me how that it tastes bad and they're just sick of it, and but that's all there was. Well, nowadays with implants, dentures are a whole lot better. And that's why I wanted to show you this. This is a little model, and if you can zoom in on this, but this is a model of a lower jaw having a couple of implants placed in it. The implants sit down in the gums and in the bone just like teeth do. But it's kind of like if you thought, if there's only something that my denture could get a grip on, that it could hold on to. Well, when you take the denture and you put these little snaps inside, and then they attach to the implants themselves, and they actually click down.
Wow.
Now, take that off for me.
Okay, let me see if I can.
Yeah.
Oh, it's a little tough.
It's a little hard.
But that's
See
good.
there?
That's what you want. You want it to be
Instead
tough.
of just like it falls off in your hand.
Right.
And in your mouth the same way.
That is
Obviously,
fantastic.
you can take it in and out yourself. It's not that hard, but it gives you something for the denture to get a grip on. So it makes it so much easier.
Now, is there anybody that this would work for or not work for? Is there anyone in particular that this would not work?
Barely.
No.
There's
Good.
barely anyone.
Good.
If you have had dentures for so long, and as I said, the gums and the bone shrink away the longer that you have lost your teeth. Well, if you've had dentures for so long that literally there's just not enough bone left even to put an implant into, but you're in trouble if you've reached that point.
Okay.
And that's one reason why you want to have implants placed, because when the implants are in the bone, your body thinks there are teeth. And so it keeps the bone there, and so it does not shrink away. And in fact, this is such an important development. I hadn't mentioned this to you before, but from now on I've read that it has become the standard of care for implants to be recommended to anyone having their teeth out and dentures placed, which means that basically from now and forward it is going to become malpractice for the dentist not to recommend implants if you're having your teeth out and dentures made, because it is so important that it makes such a big difference.
Right.
It would be not right to not say that this is one of your options.
Right. They sure have come a long way. Thank you so much for sharing this information. We appreciate it. Dr. Robin Rutherford with the Art of Dentistry. Thank you. We'll be right back with more on CBS 7 News at midday. Your eye on West Texas.